So the first the first sphere or first circle of exposure would obviously be teammates, coaches, and trainers on the same team with an individual who has tested positive, because they have the greatest number of interactions and the greatest amount of time, duration of time of exposure to the individual. As far as to the other, the opposing team, it's not that there's not an exposure there, but their exposure would be considered less just because the frequency of interaction and the duration of interaction with a person shedding is going to be less. But we would still inform that team about the potential. We would also discuss with them their opportunities for accessing testing and instructions about signs and symptoms to be observing for. But it kind of depends, right? It depends on your position. If you're a lineman directly across from another lineman and you're breathing in each other's faces and engaged in, over and over and over in a direct conflict, then obviously you're going to have more exposure than somebody who's subbing in for a play and is mostly on the bench on the other side. So it's there's no single answer to these questions, but we try to help think through what does the person do on the field, who have they interacted with, and then we go from there.